Good morning, everyone. How are you today? If you're in a warm area, good for you, because it's a little chilly where I'm at. It's starting to snow a little bit. So today, my little heart-to-heart talk with you, cardiac thrivers, is about something pretty serious. And it's a story I heard about, and it's regarding medical error. Medical error is the third cause of death in our country. And that's number one being heart disease and number two being cancer. So if you think about it, heart disease kills more people than every cancer combined. And then after the cancers are medical error. It's a fact, and you can look it up. And what kinds of things constitute medical error? Erroneous medications or not being taken off medications. So what do you want to do when a doctor prescribes medication? Because, once you leave the office, and if you miss an appointment or a recheck or a refill or whatever, or you are not able to come back with your results of the medication, you could be on that medication in perpetuity. And what you want to do is say, okay, I understand this is going to get me over a hump, but what is the plan to get off that medication? That's an example of how you could wind up a victim of medical error if you're on a medication that you do not need to be on, or there's no plan to get you off of it after this speed bump you're going through. Second thing I want to share with you is there are procedures that people are undergoing that are unnecessary. And a story I just heard about was someone who went in because they wanted to get an echocardiogram. They wanted to see what was going on with their heart after a heart attack 2 years ago. So they wanted a check, which is a great thing to do. The echocardiogram is a sonogram of your heart, and it checks the it's like an ultrasound of the heart, and it checks the structure and function of what is going on. So you can see if there's something like myocarditis happening, or if your heart is not pumping properly, if there's any anomaly going on, structure and function. And so routine echocardiogram comes back that he has a lowered ejection fraction, 35%, and that his heart rate was high. And now this is a picture in time, and so they admitted him to the hospital, but he was feeling fine. So catheterization was done on him, and it came out great. His stents from prior are cleaned out, actually, looking good because he had been doing work on it. And yet they wanted to take him in the following day for an ablation. And so he got on the table the following day for the ablation. And they got inside and they said, well, there's no arrhythmias. There's nothing going on. So they, didn't do any kind of burning or freezing of the tissue to stop an arrhythmia. And they concluded the procedure. So that was a procedure that didn't even need to be done. And now this particular person is on a Holter monitor, a Zios monitor, to record his heart rate and rhythm. And none of that needed to be done. So this is an example of how you can have a real problem. And he's also on medications now. And what he would need to do is ask, what is the rationale for this medication? Always ask, what is the rationale for this? If they can't answer, then I would consider a second opinion, or not going through with this at this time. Same with medications. What is the rationale for me to be on them? And what is the plan for me to get off them? All right? So remember, medical error, number third cause of death in this country. I'm not specifically blaming doctors, but the way the system is set up, it's impossible for someone to manage you as if they're just considering you every day. After the day is done and they've seen you, they're on to the next boatload of patients at 10 minutes each in the office. And that's no way to be able to manage someone anymore these days. And more people resultantly are getting away from the standard Western medical model of care and seeking people like myself who are holistic. I created a program for patients, for clients, cardiac clients, to heal holistically, whole body healing, because cardiac disease doesn't start in your arteries, it started because of something else. And we have to see the body as a whole unique system working together, and not just saying, oh, this one organ, the lung, the kidney, the heart. No, we have to work on the whole body. And where does it all start? Mindset. Some of you know my big thing about mindset. And why is that? Because that affects your hormones, your stress level, your cholesterol, your inflammation, and ultimately it affects your heart and your cardiovascular system. So guys, what are the 2 takeaways today? Look at my program and join my program and have great results like my folks are doing. And the other thing is ask for the rationale. What is the rationale for me to be on this and the plan to get off it? All right. Make it a great day. Remember, there are people who don't have the chance that or opportunity in their life because of what's going on to make changes right now that could impact their life. You do. I just offered you my program. So please take a look. And if you have suffered a heart attack, any kind of heart problem or injection injury, this program is for you. All right. Or if you want prevention and family history. All right. With that, make it a great day in honor of those who don't have this opportunity. And I'll see you back tomorrow.